Welcome to another edition of EDTalks. And I'm really excited today because Dr. Eric Bricker, I've watched you and your videos, which we're going to talk about, and you're such a super interesting person. So thanks for being a guest.
No, thank you for having me, Ed. I appreciate it.
So I think our audience is really going to enjoy this too. And if they don't know who you are, I think you're going to have a lot more subscribers to a lot of your video content because it's just super logical, makes total sense, and your whole approach to healthcare is rich. And I love the fact you tell it like it is. But I don't want to get too far along. But you are the medical director for Simple Pay Health, and we'll talk about Simple Pay Health. But you also, in the videos that I'm referring to, I say A to Z healthcare, but it's A, and we'll put this in the show notes, but it's like one word,
That's
ahealthcarez.com.
right.
And it's all
That's
about
right.
healthcare finance. And you don't describe it this way, but for me, going back to books that were super popular in the 90s, like Healthcare Finances for Dummies, right? It's
Yeah.
you make it, and what that I mean is you make it so simple. It's a super complex, but you have this innate ability using your whiteboard to make it simple. And that's what I love. I'm a big fan. So that's how we
Cool.
basically met. I mean, today we
Yep.
both live in the same area, but
Yep.
today is the first time we see each other and talk to each other. But I've just been a fan at a distance for a while. And I'll always like to start off with a couple, questions. Tell me about your best customer experience this past year.
Yeah. I think my best customer experience it was with Simple Pay Health, and so at Simple Pay it's a zero deductible health insurance plan for self-funded employers. So this customer is an actual employer themselves. And what's interesting is that so I started a healthcare navigation firm called Compass Professional Health Services, and one of the challenges we had that a lot of healthcare company has is just engagement with the patients, with actually having plan members or employees or family members use the service. And so we said, okay, well, what if we actually were the health plan? Like you didn't have any, like you would never talk to health insurance customer service. You would just talk to your, healthcare navigation service. Why don't we just like bake it in together? And if you need help finding a doctor or fixing a bill or, cost and quality comparisons. And so that experience has resulted in behavior change by the patient slash members. And so specifically what that means is that, and your entire audience knows this, is that, there's a bell-shaped curve for doctors in hospitals, right? We all wish it was like Lake Wobegon where everybody was above average, but at the end of the day, it's not, okay? So it's like a bell-shaped curve. And so there's like doctors in hospitals where it's like, you would want you yourself or your family or your employees, like you would want them to go see those people. And at the end of the day, it's like really hard to get people to go see those people. And so when you actually bake it into the health insurance plan itself, then we can be like, look, if you have this particular disease or condition or what have you, and you live in this particular area, then getting to this particular doctor or that particular hospital, that's the best choice for you in your situation. And anyway, just to put numbers on it, we were able to get employers to get to like 86% of the correctly matched doctors and hospitals for their specific condition, whereas previously, before using Simplify, it was only like 22%. So the point is that people are like, oh, people never change. You can't get people to change their behavior. The point is that you have to, right? It's like, the famous saying, insanity is doing the same thing and expecting different results. Well, if you want, better health and better outcomes and, more effective cost control, then you got to do different stuff. And behavior change is totally possible.
Well, let's continue down the Simple Pay Health line then. Tell us a little bit. I think you've already alluded to it, but tell us a little bit more about Simple Pay Health and what led to its formation.
Yeah. So I'll briefly weave in my background because that's kind of how it came to be. So I originally, before I became a doctor, I actually was a hospital finance consultant back in the late 90s because I have no doctors in my family, and every doctor I talked to said, whatever you do, don't become a doctor. Because the health insurance companies and the government, they're just ruining the practice of care. So I'm like, okay, well, let me learn about that. So I actually learned all about the billing and the coding and did that for several years, and then went to medical school at the University of Illinois, and then residency in internal medicine at Johns Hopkins. And I always knew that I wanted to have sort of a little bit of a different physician career path. I thought I wanted to be a policy wonk. Hopkins does a ton of policy work, so I'm like, okay, do health services research, whatever. But it was just too slow. Shocking. I'm a little impatient. A lot of doctors are impatient. And so I'm like, okay, I kind of need to see the fruits of my labor. And so I kept in touch with one of my consulting colleagues. His name's Scott Shainvogel, and he and I started a healthcare advocacy navigation firm called Compass Professional Health Services. Actually, while I was in my residency, I had to get special permission from the dean to do this. And then we are both in Dallas, and I moved to Dallas from Baltimore after I was done with my residency to start this business. And this was in 2007 when the great financial crisis was just starting. And so we couldn't raise any money. So we bootstrapped our healthcare navigation business, where we sold it to employers, where we would help their employees and their family members do all the paperwork, like all the health insurance and scheduling, all that, like no clinical decision making, but we would take care of all that other like healthcare bureaucracy mess that everybody hates. And so like T-Mobile and McDonald's, the Southwest Airlines, they hired us. We had 2,000 employer clients. We grew it to 1.8 million members, and I worked with employers. I was like the outside of the building guy. Like literally all I did for 11 years was meet with employers and brokers and benefits consultants. And I met with the employees. I would talk with the employees and go out and present to them. And so when we sold that business in 2018, and so to finally answer your question, at Compass, we could engage about 25 to 35% of the employee population, which for a navigation service is actually really high. But of course, it's not even close to everybody. And so we were just missing a whole bunch of folks. And we were helping people from like mental health crises needing like inpatient psychiatric care, to labor and delivery, to new cancer diagnosis, to I just need to see a dermatologist because I have an abnormal mole. I mean, you name it, we were helping them. But again, it was only 25 to 35% of the folks. And so Scott immediately, our CEO, immediately went out and said, hey, I'm going to start an actual health insurance plan so that people don't have to be like, well, is it Blue Cross or Cigna or Aetna or the Compass Health Navigation? Like, who do I talk to? The answer is that, hence the name Simple Pay. It's you talk to one organization, and it's your health plan. And that's super helpful because that way you don't have to make multiple calls and figure, because at Compass, one of the keys to our success is that no matter what your problem was as a patient, we owned it.
Nice.
That's the point. Right now in healthcare, you call the doctor like, it's not our fault, it's the insurance company's fault. Call them, right? Whereas if you call the insurance company like, well, it's not our fault, it's the doctor's fault. You call them, right? And so at Simple Pay, we're like, we own it. Whatever your problem is, like you can't get your prescription refilled, they're charging you this ridiculous copay, whatever, like we're going to own that problem and address it for you. And sometimes the insurance company's at fault. Sometimes the doctor's at fault. Sometimes they're both at fault. But the point is that by actually, and again, it's only for self-funded employers. It runs on a big national network, so you don't have to use some sort of rinky-dink network. But the point is that employers actually want to use the navigation to actually steer employees to the best doctors and hospitals within that network. And so they use Simple Pay Health as a way to do that. Now, the last thing I'll say is just to make things simple from a cost perspective, it's zero deductible and it's only copays, right? Because everybody's like, oh, price transparency, what's the cost? Well, when you make it copays, you can just give somebody a menu and be like, look, your lab is $35. An MRI is $200. You want to have a baby? The baby's going to cost $750. Like there's no guesswork. There's no gazillion bills. It's like a baby is $750. And so by simplifying the out-of-pocket costs for the members and then navigating them, it's like buying like anything else in the normal world where I like know the price in advance and then like that's actually what it is. Like it's just a crazy thought. So anyway, that's what we've been doing. And anyway, I'll pause there.
No, that's a great explanation. And obviously from a clinician satisfaction, patient satisfaction, the numbers would be way up for the reasons that you cited. Is there anything that differentiates itself, clinically? Like, does that help with any sort of clinical outcomes, or is it all about the same?
So yes, and that is, as the insurance company, as Simple Pay as the health insurance company, we know that the real magic happens when you match up the right patient with the right clinician at the right time. And so, like, we at SimplePay, we're not trying to play doctor, right? We're actually facilitating the doctor-patient relationship. And as you can imagine, listen, at a very basic level, you know what one of the challenges for people is, especially in this post-COVID world, is just access. It's just getting in the door. And we have a lot of people where it's like, I need to get in to see a doctor. I can't find anybody to get into. And so just think about it. Like, if you have back pain, like, you'll suffer with your back pain for fewer days because you don't have to wait 2 weeks to get into the office. You could get in like later on the same week. I mean, just in terms of, and then if you have a disease like diabetes, well, that disease is progressing silently the longer you wait before you address it. Well, my doctor can't see me for 6 months. Well, while that 6 months is transpiring, your diabetes is wearing away at your retina and at your kidneys and at your, at your neurons, et cetera. And so just being able to like triangulate, because the typical interaction with a member is, hey, I'm Joe, I live in this town, and I need to see a cardiologist. Okay, like, what should I do? And we're like, okay, well, we got some options here. When do you need to see him? Where do you need to go? Whatever. And like, do they take your insurance? Are they highly competent? Do they have, good outcomes, et cetera, et cetera? We do all that for them. So we're just like, look, Joe, here are your 3 choices. You can do this week 5 miles away. You can do next week 2 miles away, or you can do in 2 weeks, 7 miles away. They're all great. They're all super cardiologists. They all take your insurance. An office visit's gonna be $60. What do you want to do? We're like, oh, that's a pretty straightforward decision. And just getting in the door, like, we're not going to make them better. The cardiologist is going to make them better. And so just facilitating, making that happen, as stupid as that sounds, what I just described to you, that's actually very difficult. And that's actually really hard for people to accomplish. And if you can't accomplish that, you can't accomplish anything.
Yeah. No, it makes total sense to me. It just makes me smile because it's so true. And we all know, everyone knows how dysfunctional our current healthcare is in United States, and it's not perfect any place. So I'm always like careful to sort of balance things. But yeah, there's a lot of dysfunction, and simple pay sounds like a real pragmatic approach to taking out the complexity, making it super simple, and having better outcomes in all those particular areas. So, Eric, one of the things, as I mentioned at the top, that sort of attracted me, to you is all the videos that you do. And I don't know, what is it? You have like a gazillion views or something, like 150,000 every month. You have a lot.
It's mostly on YouTube and LinkedIn, but it was like 1.3 million views in 2022 alone.
Yeah, no, and there's a good reason. So again, I'll put in the comments section somewhere, how to find the website, and then subscribe to you on LinkedIn and so forth. So tell us a little bit about A to Z Healthcare, and what was the impetus to its formation? Although I think we got a pretty good background on why it might have been formed.
Yeah, so A Healthcare Z, and I called it A Healthcare Z, frankly, because I needed a URL for a website, and I needed something that was available. So if I had the letter A, and then the word healthcare, and then the letter Z at the end, .com, I could get that. So that's where the name came from. And, because at Compass, I was out working with employers and brokers and consultants, and really the people who are paying for the healthcare, for about 60% of Americans get their health insurance coverage through their job. So it's larger than Medicare in terms of the number of people. And the people that are writing the checks, in other words, they have budgetary decisions. At the end of the day, a lot of them really don't understand how the healthcare system works. And so frankly, in many ways, they're being taken advantage of. And so when we sold Compass, I'd literally seen this. I'd been in these meetings, and I spoke face to face, again, from the CEO to the frontline employee and everybody in between. I literally talked to them, and I'm like, holy moly, we got a lot of educating to do here. And because I wasn't beholden to anybody, I could kind of shoot people straight and just be like, look, let me tell you how it really is. So A Healthcare Z is Healthcare Finance Explained, and it's anywhere from like 4 to 10-minute videos, and I've got like 400 of them. And it ranges from, how, health insurance works, to how hospitals, set their prices, to how doctors do referrals, to how, electronic medical records work, to PBMs and pharmacies. We even get into government stuff like Medicare and Medicaid. And so really the viewership is it's not only nationwide. I have a ton of international viewers of software developers in India that make software for major U.S. health insurance companies, and they have no idea why they're doing it. No one ever explained to them why they were making that software. And they're like, oh, that's why I'm making the software. Thank you for telling me. No one ever explained it to me before. So that's what I'm doing with A-Healthcare Z.
You should try stand-up comedy as well, Eric. You have great delivery, and you can find you just have to laugh, right, at our healthcare system sometimes, and all the mechanisms, and it's like you're just exposing it. And again, such a simple way. I'm super interested, in terms of the creative aspect. So if someone hasn't seen your video, which I'm sure everyone watching will now see your videos, you use a whiteboard and you have over 400 videos. How do you come up with ideation, and how long does it take you? Is it something you just think of and you just scribble on the whiteboard and then hit record, or sort of what's your ideation process? I'm curious.
Yeah, and so I keep my antennas up. So I'm constantly, whether it's talking to potential customers or existing customers, or it's interacting with folks like you who have worked in healthcare. I do consulting work as well. So in terms of the people that I'm consulting with, or just reading various newsletters or news stories or whatever. And the U.S. healthcare system, it's the largest industry in America. It's about 20% of the workforce is employed in healthcare. $4.3 trillion industry. I mean, the topics are endless.
Yeah.
Like at 400, I'm just getting warmed up. Like I'm not even close to. And so what happens is I have a conversation with somebody, and I'm like, you know what? Like, why this is happening is not very obvious. And so the reason why, so healthcare is very simple, okay? And it was actually Charlie Munger from Berkshire Hathaway who explained this. He said, look, healthcare is messed up because the incentives in healthcare are all wrong. And it's the incentives that are oftentimes completely obscured from everybody involved. The doctor doesn't understand the incentives, the patient doesn't understand the incentives, the insurance company doesn't understand the incentives. And so whenever I see something happen in healthcare, I'm like, okay, let me make a video explaining why this is happening. And let me make a video explaining not the what, right? I mean, because you can just read a newspaper article about the what, but it's why is this happening? And what are the incentives that are driving this to happen? And when you do that, you find that everything in healthcare happens for a reason. It's not just some like random, event or whatever. Like it all has a reason behind it, and it all has people behind it, because healthcare is the way it is because of choices that people make. Okay, there's not some sort of like healthcare god that throws down lightning bolts from up above, right? Healthcare is the way it is because specific people and specific groups of people have made specific decisions and taken specific actions. And so it's talking about why they do what they do, and also who those people are. It's not always obvious who's even calling the shots. Yeah. And so it's like, I'll give you one very quick example. So the number one source of financial income for the American Association of Retired People, AARP, is United Healthcare. United Healthcare pays AARP more than their members do. And so when you say to yourself, why is AARP? AARP is hugely involved in healthcare lobbying in Washington, D.C. And it's like, okay, well, if United is paying AARP, then why is AARP doing the types of lobbying that it's doing in Washington, D.C.? Aha! That makes a lot of sense when you understand where the money's going. So anyway, that's why I do
it. No, this is great. And everything resonates with me. I'm thinking too, Eric, we just wrapped up a book. My friend Chris Ross, he's the CIO of Mayo Clinic, and I was at Cleveland Clinic. We both had cancers about the same time, and we had this experience. We decided to write about it, but we wrote a book for the public, so it's not for healthcare. It's going to come out this spring. But we were in there. We try to for the public. We try to unveil like what you're doing a little bit, like behind the scenes. Why did you get that referral from that particular doc? You should question why. Right? Sometimes it's a very good reason because that doctor knows that specialist is the very best in the world at treating your specific issue. That's a good reason. But as we know, the reason for a lot of referrals is not quite the same. And so we don't spend too much time on it, but some time on it so people understand they do have choices. Question. It's okay to question why. Follow the money, that sort of thing. So if someone were to watch 1 or 2 videos, which ones, Eric, would you recommend, like as a starter?
Yep. So of course, like people ask me that, and I didn't have any videos. So I'm like, okay. So I have a playlist on my A Healthcare YouTube channel that is Introduction to Healthcare Finance, and they're longer videos, but it's like 6 30-minute videos that walk you through the basics. So if you want to start at the beginning, then I would start with that playlist of Intro to Healthcare Finance.
Okay, yeah, that's a good place to start. So look, in the last few minutes, we talked about SimplePay. Well, we learned a little bit about you, jumped right into SimplePay Health. Then we went to A Healthcare Z. Now I want to sort of end with leadership. So what is the solution, Eric? What if you were suddenly the czar and you were able to start from scratch for healthcare? What might it look like? What sort of leadership would you provide to say this is where we should go?
Yeah. So I have no unique ideas. This is not my idea. This is the idea of Dr. W.W. Mayo, who founded the Mayo Clinic back in the late 1800s. So the best thing to do is not a new idea. It's an idea from the 19th century. And so when Dr. W.W. Mayo started the Mayo Clinic, he said, all of my doctors are going to be on salary because I don't want them to be paid more for doing more. And I don't want them to be paid more for doing less. I want their pay to be independent from their clinical judgment. Because even in the 1800s, he saw how doctors did fee for service back then. They didn't charge the government or Medicare or employers. They charged people directly.
Yeah.
But he saw doctors charging their patients to be like, oh, you owe me 6 chickens for this procedure that I'm doing on you. And you owe me 8 cans of paint for what you're doing over here. And he saw that the doctors were doing more than they should because they wanted more chickens and more cans of paint. And so he said, we're not going to do that at the Mayo Clinic. And so, in my opinion, that is the best way to practice. Oh, by the way, that's what they do at the Cleveland Clinic. Oh, by the way, that's what they do at Johns Hopkins, where I did my residency training. And so to just get, and so literally the American Medical Association in their ethics statement says that doctors should never do more for patients just to make money. They explicitly say that. Okay, fine. I agree with that. I think every doctor in America agrees with that. Then why don't you just change the reimbursement system to align with that?
Yeah.
Like, it's not complicated. This is not an Eric Bricker idea. This is a W.W. Mayo idea. And it would have profoundly positive ramifications for healthcare in America.
Yeah. Yeah, that's a great place to start. What is the best advice you ever received?
Trusting God.
I like
and
that.
lean not on understanding. Proverbs 3. I mean, there's many world religions that believe in Proverbs 3. King Solomon said, God, make me wise. God said, poof, you're wise. And then he wrote it down in Proverbs. And he said, lean not on your own understanding, but in all your ways acknowledge him, and he will make your paths straight. So trust in God, not yourself.
Proverbs 3, 5, and 6. Verse 5 and 6.
Yeah.
Yeah, that's good. And what about the hardest decision you ever had to make?
Hardest decision? Oh, well, I would say that the hardest decision is also the most important decision that I've ever made. And the most important decision that I ever made was who I was going to marry. So I had a mentor in medical school who even told me that. He said, Eric, the most important decision you're ever going to make is who you choose to marry. And so I was very fortunate in that I have made a wonderful decision, and so much happiness and joy can come out of that decision. And at the end of the day, you know, a lot of hardship can come out of that decision too. So that's a super important decision for people.
Yeah, no, that's awesome. And together you've had 3 kids.
That's right.
And so my last question, really back to you, sort of open-ended. We covered a lot of different areas, as I already summarized. And is there anything that I missed that you'd like to share, or anything that we talked about you want to double down on?
I just want to say that for obviously the vast majority of people watching this video and listening to this podcast are working in healthcare, and each of us can create our own little island of improvement. So we don't have to boil the ocean. We don't have to look at healthcare as this unsolvable, massive problem that we individually can't do anything about. That's not the right way to look at it, in my opinion. It's like, what can I do now in my own little corner of America to improve healthcare for patients, for my coworkers, et cetera? Like, just start small and local and incremental and just take baby steps around what you're doing, and you will make a world of difference to that one person. That's all we need to do. Just make a world of difference for that one person. You don't need to solve healthcare. You don't need to fix healthcare. You just need to help people one person at a time. And we're all capable of doing that.
No, that's great advice. Yeah, and like you said, it all matters, and everyone can take action. Eric, I really appreciate you. The way I appreciate your personality, your energy, and what you're trying to do, and I really encourage all of our my audience here at EDTalks to go out and find those videos because they're so helpful to me. And I've been in healthcare for a while, and I'm learning all the time from your content. And again, the way you deliver it, it just resonates with me. So again, thank you for being our guest, and thank you everyone for watching EDTalks.